All right. Hi, everyone. Uh, for those of you who don't know me, I am Maddie. I'm the flight coordinator for Angel Flight East. I'm going to be joined very soon by Dr. Slame. What we're going to do today is just go over exactly how we're going to restart our missions with you. We're going to something totally new that none of us really know going into what we're going into, and now how we're going to proceed with additional safety considerations. Discussion will be recorded. It will be later posted on our website. So if anybody has any questions, if they want to go back, rewatch and go from there, you're more than welcome to. We will be able to send it out to you. Also, this webinar will be muted. So if you have any questions, if you scroll over your screen, all the way down in the center is the chat box. You can send it directly to Jess. And she'll field it over to me and Dr. Slate. We put a lot of information together. A lot of it stems from the questions that you all sent me, so we're very appreciative for all of that information, and we're really excited to get started. So, go ahead, Danny.
All right, well, it's a real pleasure to be here today. I'll introduce myself briefly. My name is Dr. Daniel Slame. I'm a family physician, and I'm also a doctor with International SOS. It's a global medical assistance and evacuation company. I guess first and foremost, I'm a member of the board of Angel Flight East. So I do speak about COVID-19, coronavirus disease 2019, or SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2 often. And I've discussed with a lot of different entities about proper steps, given the best practices that we know at this time about being safe. And so my intention today is to speak about that, about how we're going to go ahead and recommence the activities that we all love to do. And I'm hoping that we can do so in a way that is smart and helpful and safe for all parties. So thank you. Maddie?
So we're going to break it down, this whole conversation, by before, during, and after flight. So that way we can make sure that everybody is staying safe and taking the best precautions. These are not rules that you have to follow necessarily, but we do highly encourage it just as best practice. So we will be working in conjunction with passengers, physicians, and moving on from there. So before the flights, logistically, as we all know, this is a very dynamic time, and there's going to be a lot of changes going on, and we're really planning on just rolling with the changes. So we understand that this could be a very frustrating time, just because it's so unknown. That being said, we ask that everybody is flexible, both passengers, staff, and pilots. So from there, we are going to call the passengers 2 days beforehand and confirm with them they do not have a fever, they haven't been around anybody exposed or exhibiting symptoms, and a few other questions along those lines. From there, they are also required to send me a picture of their thermometer after they've taken their temperature to show that their temperature is under 100 degrees Fahrenheit. From there, we will also be providing a pre-flight COVID-19 symptom questionnaire that we ask them to complete by signing and sending it back to us. So we have written proof, if you want to call it, that they are being as honest as possible with us, with the honesty system. Ahead of time, we ask that all passengers and pilots communicate as much as possible by phone, text, or email, just so that way we can decrease face-to-face interactions. I know that in the kinds of airplanes that we use, there's really no such thing as social distancing, as we all know, but just to eliminate as much as possible. So we always err on the side of over-communication before flight. So Dr. Slame will go ahead and explain the medical side.
Okay, thanks, Maddie. So again, we're still focused right now on the period of time before a mission that you go on. And I'll start by saying, again, the goal here is to weigh out the risk-benefit analysis of doing missions and doing everything that we can to make sure that all parties stay safe. We know that right now in Pennsylvania, where I sit at the moment, the rate of infection has gone down considerably over time. And There are little outbreaks that happen here and there, but can feel with some degree optimistic. With that said, about half of the country, the state's rates of new infections per day are going up. And that is true in places where they were very strict about the restrictions. In some places, that's true. And certainly it's going up in places where they were not strict about the restrictions. We also know around the world where the rates have gone down considerably, there are outbreaks again. So we have every reason to believe that outbreaks could reoccur here. And that means that we all have to be flexible. We all have to be alert. And that means that we have to be aware that while we slowly open up, we might also make a decision at some point to back down again. And if any individual, a person or a passenger or a pilot becomes suspected for or confirmed to be positive, we have to realize that we may cancel a flight even at the last minute. So this will be a learning curve, and we ask everybody to be sharp and use their critical thinking skills in these measures. So the first thing I want to talk about is safe selection of passengers and pilots. Now we know for our passengers that are listening to this now, or for our pilots that are doing so much for our passengers, many of you have conditions that make you somewhat immunocompromised. And I'm going to be talking about a number of conditions that are all coming directly in order from the CDC, and they might apply to you. So it's a conversation that you should have with your doctor about, if it's knowing that you'll be around someone else, probably within 6 feet for a long period of time, that it's possible they could be COVID positive. This is a discussion for you to have with your doctor about if that risk is worth the benefit of the treatment that you'd be incurring. And I would think for most of you, the answer is yes, it would be worth it. But again, that's a discussion between you and your doctor. For our pilots as well, I also just want to talk about folks who, if they did become positive for COVID-19, if they were exposed to someone who's COVID-19 positive and then they got it themselves, the risks of a poor outcome would be higher. And this is just from the CDC, but I'm going to be going down a bit of this list. And if you have any of these conditions or anything else like that, you're going to want to talk with your treating doctor, your primary care doctor, and make an informed decision on weighing up the risks to yourself versus the benefits of your contributions that you're making. So we know, based on statistics, that older adults, and the CDC defines this as 65 and older, are at higher risk. Also, people living in nursing homes or long-term care facilities, but we don't expect those folks to be pilots on these planes. And then also people with underlying medical conditions that are not well controlled in particular. I'm going to give an example of some, and there is a list here that I'll be giving. So bear with me. It's chronic lung diseases such as asthma, heart conditions, various illnesses that can cause immunocompromise, such as cancer, people who smoke, people with bone marrow or organ transplants, immunodeficiencies, poorly controlled HIV or AIDS, prolonged use of steroids, obesity, diabetes, chronic kidney disease, liver disease. Those are all some conditions that will put someone at higher risk if they in fact did become COVID positive. And so the next thing I want to talk about is symptoms. And I know we've all been watching the media, and we've all been living this since December, or a few months later. We've been following this. We know the symptoms, but I'll just repeat them here. And this is what I'd like you as pilots and you as passengers to be looking for and report ahead of time if you have anything that is like these symptoms, so we can all make an informed decision if the mission should proceed. And those include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion, a runny nose, nausea or vomiting or diarrhea. And again, many of those symptoms, they sound like all kinds of other illnesses that people have, including chronic illnesses, which is the reason why you're using Angel Flight East in the first place, to move to get those taken care of. So if you have those symptoms as part of your chronic illness, if you're a passenger, then that's something to discuss with your doctor. And please have the discussion because we want everybody to be protecting everybody else. We have to look out for our passengers and we have to look out for our pilots. And then the other risk I just want to talk about is exposure to others. If prior to the mission, whether you're a pilot or you're a passenger, if you think that you've been in a high risk environment, if you, for example, work in an emergency room or an ICU, or if you are around a family member or a neighbor or somebody who you suspect was positive, it's important to be transparent about this. Speak up, let us know at Angel Flight East, so that way we can inform the pilot or the passenger of the situation and we can all make an informed decision together. And I'll just talk a little bit about what to bring when you're preparing to go on these missions. For pilots, it's important that you're responsible. Nobody knows your plane as well as you do, and so we do recommend that you follow your manufacturing guidelines. I could talk to you right now about what kind of wipes would be appropriate for the seats in your plane and how you're supposed to clean your windows and clean the handles and all that. But every plane is different, as you know. And so the best that we can do here is to refer you back to the manufacturing guidelines, reach out to them and ask them what are the best cleaning supplies for you to use. And err on the side of being overly clean. This is something that we don't want to mess around with. For pilots, your passengers may be immunocompromised, so we don't want to take unnecessary risks. We want to do everything we can to keep them safe. And it's good for the passengers to see that, so that way they know they can feel safe as well. For everybody, pilots and passengers, we do want you to bring masks as well. Now, if for some reason you feel like you can't wear a mask, maybe as a passenger, the reason why you're moving is you have a breathing condition that wearing masks would make it hard to breathe. Well, then you may not be in a spot that you can wear a mask. But if you can wear a mask, and if you're a pilot and there's no problem with wearing a mask, we would ask you to do that because you're probably going to be within 6 feet of the passengers, and we want to do everything we can to make them feel comfortable. As far as the passengers are concerned, of course, you're welcome to bring wipes and hand sanitizer, but wipes for yourself. But before you use them on the plane, please speak to the pilot first. The pilot will know what kinds of wipes are needed to keep things safe, and he or she may have those already set up and take care of that. So don't use them without asking the pilot, because we want to be careful to keep the plane in great working condition for a long time to come. With that, we'll move to the next phase, the during the mission flight phase of this conversation, and I'll pass it back to Maddie. Thanks, Maddie.
You got it. So we are going to be limiting the number of passengers going during flights. That doesn't mean I'm going to be less stricter and say no to people. What it means is we're going to be more cognizant of the companions going along with the flights. So, for example, we all know that there are some passengers who are on the older side and struggle with memory and things like that. So having that person to hold them together. So, for example, if my grandparent needed to go for a trip, I would be able to go with them, just because they would need my help functionally. For other passengers, this would be like children, having their parent come along, obviously 18 and under with an adult. For passengers who just don't want to go alone, I will probably gently ask them to just understand the circumstances and grow with us. From there, we will be asking all passengers to show up early and prepared, having all necessary supplies together and ready to go. We are also going to ask for linking flights that pilots are able to meet at the time that the original pilot, or like 1 or 2 pilot, is planning on arriving at the airport, the meeting airport. Just so that way we are limiting the amount of time that passengers are going to be spending in these public spaces. Obviously, they are going to continue the sanitation from plane to plane, but just to make sure that we're not overexposing. From there, we are also going to ask that everyone brings a thermometer. Pilots, you can have one with you in your plane. Passengers, we do also ask that you bring one with you. There are some available on Amazon that are no contact. So it's a swipe of the forehead. It doesn't even touch skin. And I don't even want to say it's $50, but I can happily send you guys a link to it. So just so that way we are making sure that everybody is the safest as possible. Our temperature that we are declining flights for is 100 degrees Fahrenheit. But other than that, we trust you all and your judgment completely, which is why you are the command pilot. And Dr. Salim will be able to explain more on the medical side of what to expect during the flight.
Thank you, Maddie. And again, we're still in the during phase of the mission part of the discussion here. And we know that for the pilots here that are listening to this, we know that you make decisions all the time about if a mission is safe to commence. It happens with every single flight. You're looking at the weather, you're looking at the aircraft, and you're looking at how you're feeling. Well, at this era, we need to be extra vigilant about our own health as well. And we don't want to be heroes here and push the limits. If you as a pilot or you as a passenger are starting to, in the last minute, even though we're all excited and we need to go on this mission, if you're starting to have any of those symptoms that I discussed prior, if you are, for example, you think you might have a fever, or you think you suddenly started getting a cough, or something like this, it's better to speak up and be transparent. We don't want to take any risks, and we don't want to put anybody else at increased risk. It doesn't mean that necessarily that the flight is going to be canceled. It means that we should have a discussion about that at that time. And if that happens in the last minute, then that happens, and that'll be disappointing for everybody, but we want to err on the side of safety. So please let us know, and likewise, we'll help facilitate a conversation as well that is critical to have between the pilots and the passengers. And if you are at all in doubt, we ask you, the pilot or the passengers, to call your doctor and to have that discussion with your doctor if any symptoms you may be having sound like they could be COVID, and if in fact the mission should be postponed. Again, during the flight, we do ask anybody that is able to wear a mask safely to wear a mask out of respect to the other people in the plane. And we are always talking about physically distancing, right? You're supposed to be more than 6 feet away from other people. But we know in most of these planes, it may not be possible to do that. So if it is possible, we ask you to do that. And if it's not, well, we're doing everything we can, including having this conversation today, to decrease risks where we can. And of course, let's not forget about the cycle of infection. It often comes from our hands when we've touched the surface. And then after we touch that surface, we touch our eyes, nose, or mouth and give it to ourselves. So let's remember to be careful about not touching surfaces so you don't have to. Wash your hands frequently prior to your flight if you can. And since you probably won't be able to do that, and you certainly won't be able to do that in flight, make sure you bring hand sanitizer so that way you're able to use that. And don't touch your eyes, nose, or mouth if you don't have to do that. And let's move to the last portion, the after the mission portion. And I'll pass that back. I'll speak to that first, and then we'll end with Maddie. So after the mission is over, we ask that you continue to monitor for the symptoms that we discussed initially. If you have any symptoms at all that seem like COVID after the mission is over, for the 14 days after the mission is over, or there's some reason that you believe that you could be COVID positive. Perhaps you got a random test when you went and saw your doctor and it came back it's positive. We ask that you please reach out to us and let us know because we're going to want to make sure, whether you're a passenger or whether you're a pilot, that all parties are aware of that. So that way it's fair and kind and just for the other people on the plane to know to look out for if they have any symptoms, they may want to get tested themselves. Frankly, it may turn out that some of our pilots are doing many missions, and they could have plans to move other passengers in the next 2 weeks. And if we knew that they were at some risk, then we'd have a discussion about whether or not we should do that. So it's really important to make sure you're transparent about that. From an Angel Flight East point of view, we feel that it's our duty to inform you if we find out that anybody is at risk for being COVID positive. We're going to notify you immediately, so that way you can take informed decisions make informed decisions about what you want to do. On the flip side, whether you're a pilot or whether you're a passenger, we do request that the same duty from you, that you would let us know and your fellow passengers or pilots know if you have any symptoms. Finally, moving forward after every flight, we're going to start sending a post-mission survey. It's going to have a few questions on it. This is for pilots and for passengers. And if you find that you have any suggestions on how we could find ways to systematically decrease the risk further. If you have a smart idea on how to do that, we're all ears. We want to hear it so that way we can continue to make these missions as safe and efficient as possible. With that, I'll pass it back to Maddie. Thank you.
So logistically, the only thing that I ask after your mission is that you still continue to update your mission reports as soon as you can. And the last point that I wanted to point out was that we have updated the waiver of liability. So the waiver that you sign and the passenger sign before you guys board the plane is updated to mention the possibilities for precautions for COVID-19. But other than that, we are so excited to get back to doing what we love and what you guys love. So that being said, if anybody has any questions, now's the time. If you want to unmute yourself, you're more than welcome to just ask the question or send it in the chat box, either way.
Are you going to keep moving PPE in the future?
We do plan on it as long as we have access to supply and demand, obviously. I know some of our suppliers have moved on to some other forms of preventative measures. So, for example, they've been working on transporting COVID tests and things like that. So we might be getting involved with that.
One question in terms of liability, etc. I don't want to be a lawyer, but will we ask the passengers to sign a waiver that they don't get infected from us? Because that could be an issue in terms of Angel Flight itself, that they say, well, you know, the pilot had COVID. I don't know. Or is that not necessary?
So it's mentioned within the waiver. The one that I just mentioned was updated. But we can also review it again with our general counsel and just get his final approval.
Okay.
And I will also mention that that I, again, because we're operating and based out of Pennsylvania, but we serve a large territory, of course, 14 states in our region. But I did speak to the Pennsylvania Department of Health today, and I explained to them what we're going to be discussing at the webinar tonight, and also all of the steps we put in place. We discussed this being an essential service, and we compared it in some ways, although it's not the same thing, as anybody that would be helping with transportation of a patient. And they felt that there was no red flags that they had beyond the red flags that everybody has in this era. But they thought that we're doing the right thing, and that as long as we, Angel Flight East, are advising our passengers and our pilots to communicate with their doctors about any concerns, and they make that personal decision themselves, then all parties should be protected from what's expected from a legal point of view.
A lot of organizations, colleges, and schools are putting plans in place to know when to shut down in case we do have a recurrence. Do you have a specific sort of guidepost in that regard?
Well, I'll start off by saying that we know that other Angel Flight chapters never shut down. So we did. I've also, when I've spoke to different entities as well, I was informed that this was a decision, this is a decision that every entity's got to make on their own. But I was also told that, retrospectively, we might not have had to have shut down. So even if the new cases per day go up, which, there's lots of discussions that this is likely, and we see it all over the place that it is. We don't necessarily have to. What we're going to do is we're going to be meeting, the board is going to be meeting on a regular basis and reviewing how things are going. And we're starting, of course, slow. We're not planning on having the same number of flights. And we really do rely, we ask all the pilots and passengers that will be listening to this to give us feedback. You can either do that through the survey or through other means. And when you come up with a suggestion on how to decrease the risk further, any great ideas that you have as you're living that experience, we want to know it. So we'll start with that.
should we be a little cautious in respect to treating any developing new cases as possibly just new cases because they are doing more testing?
Yeah. I think that is a great question when it comes to large populations, when making decisions about groups of people. When we're actually talking about an individual human being, if we're talking about a pilot or a passenger or somebody that is going with the passenger, even though we're going to see when it's reasonable to decrease the number of passengers, it isn't always reasonable to do that. When we talk about those individuals on that plane, if one of them tests positive, then it doesn't matter what's happening elsewhere in the world. It's just those 2 to 3 people that are on the plane that we're worried about. And if they're positive, then there'll be a high likelihood that the mission will be canceled or delayed to another time. But again, we have to take each one of these things and based on its own merit. And I will say that unfortunately right now we don't know anything about immunity. So if you, let's say, are a pilot or a passenger who's previously been COVID positive, you got the PCR test and it was positive, and we know those aren't always sensitive or specific. So then later on you got the antibody test and it shows there's antibodies as well. That doesn't mean that you are now immune, and we don't know how long the immunity lasts. So at this point, we always have to treat every situation like you are at risk for getting it and you are at risk for giving it. And we have to keep that in mind.
So if we tested positive on the on the antibody side, does that ground us, or it's your concern is about active illness?
That's correct. Our concern is about active illness. So if you previously had it, whether you even knew you had it or you didn't know if you had it, if you happen to get an antibody test that shows that you have antibodies, and we know that those are not entirely reliable, but if you have that, then I would think it would be relatively easy for you to speak with your doctor and go get the PCR test to confirm that you don't have it now. Again, we're not necessarily making rules. There's not a law here on this per se, but we just want to be respectful of everybody's health.
Yeah.
So there's more guidelines, and we anticipate that there'll be lots of situations that emerge that we're going to have a discussion about in real time.
Thank you.
Thank you.
So for those patients that might have a lung disorder or something where a mask is not comfortable, is that a discussion that happens ahead of time, or is that something the pilot's going to have to make a decision, before the flight as to whether you can continue or not?
We want to be as transparent as possible. So ideally what we would be doing here, and we are going to be contacting all parties prior to the flight about 2 days before, but it doesn't always work out exactly like that. To ask how they're doing and what their condition is and if they're comfortable wearing a mask. If it turns out someone has got a breathing disorder that makes it difficult for them to wear a mask, then if that's the passenger, then we'll share that information with the patient. I'm sorry, with the pilot. Then an informed decision can be made.
Okay, great.
Seems like a good time to have an open air cockpit.
Yeah. All right. Any other questions? Well, we're available, of course, all the time. So if it turns out that we finish this webinar and you have further questions and you'd like to get a hold of us and ask us, please do.
Excuse me, can you hear me?
Yes.
Okay, you had mentioned that, Charlie Halbert, you had mentioned that some of the Angel flights never shut down. Have any of those had a problem with COVID that you know of?
I personally have not heard of a problem, but I also don't think that anybody is going to be advertising their problems.
Well, so, I would think that Angel flights, since it's the same, it's kind of under the same umbrella, they should share that kind of information anyway.
They should. You're right.
I haven't heard about that either, but also yeah, I think there haven't been a lot of communications between the different chapters, although there's been some. Previously, maybe about 6 weeks ago, I was part of a webinar with some members of another Angel Flight program, and at that time, still we were having our discussions about best practices, but there's no stories at that time about anybody getting COVID positive from the flight itself.
That'd be some interesting information. I mean, to find out exactly what had happened to those flights.
Yeah, that's right. That's a good follow-up. We'll look into that.
When I send out this recording of this webinar, I will also include both my and Dr. Slane's email. So if you come up with any questions between now and then, feel free to just send it over. We'd be more than happy to.
Dr. Slane, or Maddie or anybody, can you hear me?
Yep.
Yeah, Matt Newman. Has there been any feedback on pilots flying with the mask on, with any difficulty with that? Because I fly corporate for a living, and I just came back from some training where they had it as a rule we're supposed to wear the masks in the simulator, and to be honest, after about 10 minutes, we had to take our masks off. It was just really hard to operate and do all the stuff that we needed to do, and it just proved to be an irritant. So I was just wondering if there's been any feedback on that.
So I have heard both. I have heard some say that it's not fun, it's not comfortable. I've also heard some say it's not fun, not comfortable, but it is possible. Some were saying that it needs to just be something you get used to, but it all depends on the person, I think.
Yeah, this might be a good question to turn back to our audience. I'm not a pilot myself. And the other work that I do, we use much larger planes for longer movements with sicker people, like Learjet 35s and Hawker 800s. But we understand that the crew are all wearing, which is different than a pilot. The flight attendants are all wearing masks. We know that the pilots are often wearing masks. I haven't heard any stories where that's a problem, but I can imagine that it would be. And frankly, if we've got a lot of pilots on this discussion right now, it may be appropriate to turn it right back to you and ask if anybody else has tried flying with masks on, if that's been difficult.
Yeah, I just recently did some flying down to Knoxville, Tennessee with the mask on. I had a KN95, so it was about 4 hours of flying time. Overall, it made you feel more stuffy when you got done, but in terms of it didn't interfere with microphones and with the headsets or anything like that. And overall, it was once you got accustomed to it, it generally wasn't a big deal, at least from my perspective.
Yeah, I agree. Same thing. I've done a lot of flying with the mask. If you have enough fan or ventilation or AC, it doesn't seem to be too much of a problem. Some of the masks, you can even get the microphone inside. If you have too thick of a mask, it's too far away and ATC can't hear you well. But N95 or just regular mask or whatever, I haven't had a problem communicating.
Yeah, let's err on the side of safety. So if you're wearing it and you're uncomfortable, you think it's going to affect anything in a negative way, I'd say take it off. That's but if it's not, you can do it and you feel comfortable, then that would be respectful of the passengers as well.
Sorry if you already covered this, but are the passengers then being made aware that, we'll make an effort or whatever to wear masks, but if, again, being able to, safety of flight control and all that kind of stuff has got to take priority, so they understand that we may or may not wear a mask on that basis, or will they be made to understand that?
Well, since this discussion is being recorded, you have just made them aware. Thank you. Yeah, we're giving everybody the same message, whether you're a pilot or whether you're a passenger, that we want you to be safe. We want you to protect other people, but we have to make a lot of risk. decisions here. And if it turns out whether you're a pilot or you're a passenger, if in some way wearing the mask is going to be detrimental to your health or what you have to do, then all parties would have to be aware that may have to come off. And that may not be known until you're in flight. So that means everybody needs to know that prior to the flight, that the mask of the other people on the plane may come off. And I think this is a good discussion to have, frankly, between the passenger and the pilot ahead of time. No reason to not have an open discussion about COVID, people's concerns, their fears, their thoughts on it. So that it's better to have that conversation, and just in building the relationship ahead of time. You're going to be spending a lot of time with each other in close contact. So it'd be better to get all that out and have that discussion beforehand. That's always true, and it's particularly true now.
A question, Doctor. I remember hearing some time ago that the COVID is very sensitive to ultraviolet, and that don't last very long on surfaces that are exposed to ultraviolet light. Just an idea, how long do you think they last inside a cockpit of an airplane?
Every different surface type has a different length of time that COVID is known to be to survive on the surface in the first place, whether it's something that is very porous or not so. So there's a lot of factors involved. But even if you were to, let's say, entirely sterilize it beforehand, if somebody were COVID positive, let's say a patient were COVID positive, and unless you're running ultraviolet light for the whole 2 to 4 hours that you're with them, even if you clean the surface, then they would still be expelling the virus, and there would still be the risk. So that's why at the start of this conversation we talked about the population of people that would be at higher risk for an adverse outcome if they had it. Now, I don't want anybody to get it, but if you're in that population, which you may be, it's a good discussion to have with your doctor. Say, this is something that, let's say you're a pilot. I, as a pilot, love to do this. It's what I want to do. It's a way that I can help. Doc, if I became COVID positive, how do you think my risk compares to other people? It's, no one can ever know, but we do know that if you have, as you add on more risk factors, the odds of a worse outcome increase. So that's a tough conversation, but an important one to have with your doctor.
I wonder, as you think about droplets, if there is less risk in having your passenger immediately to your right rather than sort of behind you to your right.
Mm-hmm. Yeah, I wonder if the small space for a long period of time without a lot of ventilation necessarily, even if that's true, that someone who might be coughing or breathing forward, which is to your right and not next to you, it probably would be everywhere in the cockpit.
How about post-flight? Most of us will provide passengers with a headset with a mic, obviously.
Mm-hmm.
Precautions for that headset then afterwards, just sterile wipe will suffice, or?
The angle that we've decided to go, and I think it is the best angle, is the answer is probably yes. That's probably fine. But an even better answer would be to contact the manufacturer and ask them that question, because there may be some materials on it that could get damaged, and we just want to make sure that we can't speak for every one of those. But the answer is probably that it would be a regular one of these sterile wipes would be appropriate if you do a good job with that, and of course time.
Yes.
So if even if you didn't clean,
somebody grab her so I don't hear it on my Zoom, please.
So, but even if that were the case, then if you let some time pass, then it would be, you should be all right. unless you're doing missions every day, which we probably at this point, we shouldn't. No pilot should be doing missions every day just yet. Let's ease into this.
Right, changing out the foam covers, I guess, on the mic would be advisable too.
Yeah.
So what I have heard from, I believe Lifeline pilots recommended this to us. They cover the Midwest. Was either washing your sponge covers in soap and water, like Dr. Sling said, drawing based off what the manufacturer recommends. And some also have replaceable mic covers. So if that's an option for you.
From everything I read from different plane interiors and everything, the safest sort of solution to use is an alcohol, 70% alcohol solution. You can spray it on almost everything: dashboards, metal, seats, ear cups for your headphones, and you could pull the microphone covers off, and you could just wash them in soap and water. But basically, just 70, not disinfectants or cleaners, just 70% alcohol. You can get wipes that have that in it, or you can make your own mixture up with isopropyl alcohol in a squeeze bottle, 70%. So that's what I've heard and read on all the websites all over the place.
Yeah, the FAA just came out with an info letter on advising against using alcohol wipes, particularly on flat screen displays. So check with the manufacturers as to what the best means, but they say as a rule though you shouldn't apply alcohol to those displays.
Yes, I'm sorry, not displays, but everything else, the seat, the leather, you know, all that stuff, the inside, velour, whatever you got. Yes, definitely not a computer display or anything like that. Use a, you know, a cloth, electrostatic cloth.
I know Cirrus has, I play Cirrus, and they have you go to their website and they have right on top, there's a whole web page of exactly what they recommend for cleaning seats, handles, screens, and all that kind of stuff. So they're very forward about what they think is compatible.
Awesome.
Okay. Well, we're 45 minutes past the start of this discussion. I think it's been a good one. I think that this discussion is going to continue. There's a possibility that we would have another discussion like this after we've been doing this for some time, if there's a desire for that. My guess is in any follow-up discussion, there may be a desire to have more pilot input from the start than where we're at now. Of course, we need logistics from someone like Maddie and medical from someone like me, but the actual experience that you all have, I'm sure will be very valuable to share with each other. So I'll end my piece by saying thank you to all of you for everything that you do. You really are heroes. You've always been heroes, and now you know, at this time where there's some degree, increased degree of risk for yourself. Again, whether you're a passenger or whether you're a pilot, you're taking that on knowingly. And to that, I just say thank you. Maddie?
Yeah. Thank you guys so much. As always, I really appreciate all you do. And keep an eye out because some of our passengers have already been sending me dates. So we do have dates up for July and August. So, thanks, everyone.
I was going to ask if you had an effective date for when you were starting missions. So you just answered it.
Yeah, so we have the first one starting pretty much at like 4th of July time.
Great. Well, thanks for putting this together. It's a very thoughtful thing to do and great to communicate with everyone.
We're happy to do it. Thank you guys all so much, and I hope to hear from you all soon.
Thank you.
Thank you.
Thank you. Bye-bye.